Dr. Taggart, could you tell me a little bit about your experience performing telehealth?
Sure. So telehealth is a wondrous advancement in our ability to reach patients who ordinarily wouldn't be able to make it to our office. So I I, I can't say enough good things about it. It's thank God it's here, and it happened um, to just become so much more here after the pandemic. So it was an example, I think, of something, that is was horrible for our society and scary. The pandemic, an example of yucky stuff, poop becoming fertilizer, it, and so now, thankfully, our culture and mental health in particular seems to have become so much more accepting of this as kind of a normal way for patients and practitioners to interact. And I think patients and particularly practitioners have gotten better at it. I say particularly practitioners because I think I know that a lot of colleagues and myself needed to get better at this technology. And I say that with a smile on my face because I think I'm not naturally great with technology, but I um, but also well trained um, mental health professionals, I think, are pretty picky in a good way. We want to deliver quality, and I think, at least initially, so things are better now, but at least initially, telehealth, I think, was reacted to, rightly so, by the medical community and certainly by the mental health community as a situation where a lot of the important gauges on our dashboard are non-functional. Um, there's just a lot of things you can't see or experience or sense in telehealth. Um, so I think we've improved that situation to a great degree. I think just uh, getting clinicians getting much more familiar with telehealth, the advent of patient portals where patients can share all kinds of, for instance, laboratory data with us, can send us videos or photographs of certain things that they might be experiencing, sending us photographs of everything from medication labels, when there's questions about that, or, sending us photographs of that might be representative of side effects or something. Um, also, we're with portals and with other technology, we're able to share or gather things like blood pressure data, pulse, height, and weight. Laboratory results, other things that are important for monitoring effects of medications, side effects of medications. Um, it For folks who may not be aware, everything that I just mentioned can be important for mental health prescribers to be monitoring for their patients, even though those are not thought of as mental health parameters. Again, things like blood pressure, certain blood labs, that sort of thing. So in any case, we're getting. I think we've now become much more familiar with telehealth, and we have developed telehealth to the point where um, it now can give us the necessary data that we need in a lot of cases. So now here comes my reservations about it that still exists, and I think we're actively, as a field, I think we're actively trying to sort of brainstorm how can we make telehealth as good as we want it to be, because it does remain that some of the gauges that are somewhat important, that are quite important sometimes, are still non-functional on our dashboard when we're doing telehealth. And let me just give you some examples that occur to me. uh, now, and that is things like certain side effects can be not so obvious or not even detectable just in a video conference. For instance, like a patient could have a tremor or a restlessness, they could have restless leg. Those are potentially side effects of mental health medications, and the patient may not think to mention those to the doctor, and the doctor very likely may not be able to detect those unless the video camera happens to be pointing at the legs or the hands. Also things like, is the patient perspiring out of stress? Um, is there perhaps uh, something that they are uh, not wanting to mention to the doctor that may be just off camera? Um, Not wanting to mention, not because they're trying to uh, be dishonest or conceal something with the doctor, um, but maybe it's just something that they're afraid of or embarrassed of, or is out of their conscious awareness. This could be any list of things in the ecosystem around them. Could be something in their family,
Mm.
could be something at their job or career. Um, there's so many things that still we're improving, but there's still so many things that are not as detectable as we'd like them to be in a telehealth session. I'll say this, that most uh, well trained clinicians, certainly the colleagues of mine who I have tremendous respect for, I think all of us um, respond to this dilemma in the following way. Uh, we uh, really, I think, unanimously like to see patients in initial face-to-face appointments, so we really can get a sense of things globally and at least meet the patient in a comprehensive examination in the beginning, where where all of the gauges on one's dashboard are functional. Um, and then when I think this is a general consensus among good clinicians that when things are going pretty well, pretty stable, maybe the issues or concerns are relatively minor, telehealth is absolutely a very reasonable way to follow up. When there are concerns, things are not going well, certainly if there's a question of side effects, especially if those are physical side effects, that's when really the clinician and the patient should collaborate in finding a way to make the appointment be face to face and in person. Those are I would say, consensus feelings among well trained psychiatrists that are agreed upon nowadays in the national conferences that we have on these dilemmas like this. So those are my thoughts.